So good morning, good afternoon, and good evening, everyone that is on the line right now from wherever you may be, to our latest VIA Live product training webinar series. And today we're going to be featuring the LifeWrap non-pneumatic anti-shock garment, also known as the NASG in some parts of the world. This is one of our top selling products, and so we're very proud to be hosting Dr. Sheela Mane from Bangalore, India as well. But before we talk about the product, I'd like to just introduce VIA Global Health before we even get started. So what VIA Global Health is a online marketplace where you can source, quote, purchase, and ship products from anywhere in the world, and we help make that process faster, easier, and more affordable. So to help do that, we can talk a little bit more about who we are. So if you want to learn about the VIA Global Health company, you can just go to this company page and look for the About VIA. You can see our latest news. You can meet our team. You can even look at things like our Market Insights program, where you can be involved as a panelist to provide your insights and be rewarded with rewards points towards purchases. And you can learn more about rewards points here. The product training videos similar to this webinar, we'll be recording this and posting this to our platform of other training videos. And then you can look at our customer success stories, so you can hear what our customers are saying. Different people who have purchased products from us, different suppliers who actually sell through us. Just really hearing from our customers about what their experience has been with VIA Global Health. So it gets you an idea of what your experience would be as a customer as well. But here you can see some of the different partners and publications that we've worked with. You can even watch some videos about who we are and what we're doing. We do have offices here in North America, also in South Africa, running their SADC and Africa region. And then our India office is actually being changed at the moment, but we do have a presence there in India as well. Jumping over into the site, again, you can search from our thousands of products any way you would like. You can look here in our product categories, anything from furnishings and audiology down to women's health and maternal health. So maternal and newborn health here is where you would find the non-pneumatic anti-shock garment. You can also just do a search here for really any product. So we'll just do for something like an ultrasound. What that'll do is you can just type ultrasound and click enter, and it'll bring you to a page of all ultrasounds. Or you can just type it here and it'll show you all of the options. So just to go to show you, we don't have one product. We typically have many products of the same type. So you can choose the one that's right for you. Also, what we like to do is just feature our most innovative products on the homepage here. So you can see a range of products, but the first one we want to look at here is the non-pneumatic anti-shock garment. So before we step into the actual expert webinar, we want to just show you our product page. And we developed this to be really your brochure with all of the information that you require. We know the questions you're asking. We know what you need for your private inquiries, for your government tenders. You need to see pictures of the product. You need to see the regulatory approvals. You need to know descriptions about what this product is. You want to hear about other industry experts and what they say. And really just longer descriptions, clinical research and case studies and clinical trials that have been done so that you can verify the quality based on research that has already been conducted. Some information about frequently asked questions about sizing, about cleaning, some basic information. And then we also have videos. So if you need to see videos on how the product works or instruction of how to use it, or even looking at a previous webinar we did with another panel expert about a year or so ago, we house all of those videos here. Once we're done with this webinar, we'll also be putting that video here so you can watch this or share it with any customers or colleagues that you have. A little bit more about the product documents. So you can look at the brochure, the sizing guide, any other product document you might need to help you make a decision about this product is here. So what we're trying to do again is make it fast and easy for you to find information about this product without being required to contact someone and wait for an answer. And that's how VIA Global Health is making everything much faster. You can again see this for the warranty details as well. So with that, I would like to turn over the forum to Dr. Sheela Mane. We'll be asking questions throughout the webinar. This will be more like an interview. With that, I would like to turn off my screen share. So well, I guess it's good afternoon for you.
Yeah.
if you can just take a moment to introduce yourself to everyone on the line and talk about
Yeah.
your experience.
Yeah, hi. I'm Dr. Sheela, a senior consultant as well as a professor in the Department of OBG in one of the hospitals where the DNB postgraduates are there. I have almost 37 years of experience in obstetrics now, and I have worked in public health as well as private health, setups as well as in medical colleges, and handled almost all types of emergencies. So my special interest is high-risk pregnancy, and also we have a hospital where we are having a HDU where we can manage all the complications associated with pregnancy. My association with our local association has been long, and I've worked as a Safe Motherhood Committee chairperson for our national federation, that is FOGSI, from 2008 to 2011. Then I was a vice president in 2014, and since then I have haemorrhage, and I've done almost more than 100 PPH workshops with some hands-on training. So I'm very happy to share my thoughts with all of you. Thank you.
Excellent, thank you. And how many years have you been working with the non-pneumatic anti-shock garment?
It's almost 10 years now.
Wow, 10 years. And how did you first come to find out about this product?
I attended one conference in Delhi where I met Professor Sulen Miller.
Ah, of course.
Also doing a demo on one station, that was the medical management, and then I went and met her, and I came to know about this. Then again, I think second time, I think I met her in a conference, FICOG conference at Rome in 2009. And since then, I knew that I have to propagate the use of this such a valuable garment because it really saves lives.
Excellent. And if possible, would you be able to share a few experiences you've had using the NASG with any of your patients, just so that we can give some context for how life-saving this product can be?
Yeah, there was a third gravida who delivered, and she was still lying in the labor room. And after some time, when we were in OT, we got a call that the patient, when they were trying to shift her, she fainted and collapsed. So we, all of us, by the time we came, we just ordered over the phone that apply anti-shock garment till we reach the, I mean, it's in the same premises, but when she fell down, naturally fainting attack, and the pulse and blood pressure was not recordable. But immediately she was put on the table and anti-shock garment applied, and we could feel her pulse and her blood pressure was recordable. Immediately we started all other measures. We shifted to OT with the garment in situ, and then we explored her under anesthesia to see whether there are any retain products or anything. And along with the anti-shock garment, as she continued to bleed, meanwhile we had arranged for blood and blood products. We also tried to do the balloon tamponade for her, but that too didn't work. But we kept the anti-shock garment and we corrected the hypovolemia by giving her blood and blood products. We saw that the blood loss was not noticed in the fourth stage, and she was about to go in for DIC. So quickly we arranged, but we found that after applying the anti-shock garment, yes, the blood loss had come down and we could revive her, and the number of transfusions required for her was definitely comparatively less as we applied the anti-shock garment and the blood loss came down. So whatever she had lost earlier, we had to replace, and we saved her.
Excellent. And so that's a very successful story. Yeah. Is that a recent story that you mentioned?
Recent story was another consultant had done a cesarean section, and there was a bleeding during the surgery, but she ordered for 2 pins of PRBC, and she said, transfuse this and I'll come and see her later. But that was given very slowly, and then at night they noticed that the patient has tachycardia and her output was very less. So then there was an emergency call for me, and I'm not exaggerating or anything. We have an anti-shock garment in that hospital, but I have one with me always. So I went with my own anti-shock garment there. We immediately applied that. Pulse was 170, you won't believe. Her shock index was more than 2. Pulse was very feeble. We applied that. We did aortic compression and we gave her IV fluids. Immediately we pushed 2 or 3 PRBCs. So her general condition improved, oxygenation, everything was given. We shifted her to OT. Even though she was a primate, because her condition was not satisfactory, we had to do hysterectomy, but we could save her. And later on, we corrected her hypovolemia with the blood transfusions and all that. But after applying anti-shock garment, her condition improved. Otherwise, the anesthetist would have given the anesthesia and we would have just left her like that. So that day, I really felt that it is such a simple measure, but it saves life. And it's so important, And even though we applied after, suppose if we have applied and we take the patient to OT, we can still operate. We have to keep the segments 1, 2, and 3 in situ. And we can remove only 4, 5, and 6. We go ahead, we operate, and we reapply again 4, 5, 6 segments. And we can keep it till we are happy about the patient condition and till she recovers.
Excellent. That's excellent. It's incredible to hear those stories where patients are actually being saved. It really puts everything in context. And we have a few customers that are on the webinar right now that have shown an interest in the anti-shock garment but have not begun using it. So how would you describe this product to someone who is interested but has not begun using it yet and they would like to know more before they can make that decision? Something that might help them understand the importance.
See, as I said that once we apply the garment to the patient's lower half of the body, the blood from the periphery shifts to the vital organs, that is the heart and the brain. And that keeps the patient stable. And the blood loss from the pelvis area, as the patient has delivered, she is going to bleed from the pelvis, comes down drastically. Okay. And that itself helps to revive her condition. Another thing is the patient remains in a stable condition. In case, even if we want to shift the patient to other facility or to other place, the patient remains in a stable condition. Still she reaches the facility. Because in certain situations, we have shifted the patients. Because where I'm working right now with the public facility, the blood bank is not so well. So sometimes we have shifted the patient to other hospital. And while shifting the patient was stable. Till she reached the facility, she was stable. So it's very useful. Even if you are not able to handle the situation, you can apply the garment and you can shift the patient. If you are waiting for the help to come in your own center, even if it is a tertiary care center, you can apply the garment. And meanwhile, you can arrange the blood. Another advantage is, yes, you can put her in lithotomy position and you can do all the procedures. Suppose if there are tears, we can suture it. There is a retained placenta, we can remove it. We can do bimanual compression. Even we can do uterine massage with the garment on the patient's body. And even we can do aortic compression also. So there are so many advantages and the patient is comfortable with this. Patient will not, it's not like a tourniquet. Okay, so the patient is comfortable when this is kept. The another experience, if you want me to share, was a case of placenta previa, a second trimester. And she came to the ER emergency room. I was doing a cesarean section. They called me that the patient is bleeding. We had instructed her, she was staying nearby. Anytime she may bleed. And immediately I told my postgraduates to apply. Yes, in antepartum hemorrhage, in second trimester, we are not very maybe we can use it. From there, the patient was shifted to OT. We opened 4, 5, 6 segments. We operated on her. Yes, we had to do stepwise devascularization, then the compression sutures for the lower segment. I had to pack the lower segment and we replaced the blood. We kept the garment on her at least for 12 to 16 hours and she recovered. So there are so many situations like this where I have found that it was very useful because this patient, when she came, her blood pressure was only 60 systolic. After immediately we applied, at least it was 90 and she was anesthetist. They're happy that they are going to give anesthesia to her. So that makes a lot of difference and your confidence also is boosted up if you have a patient in a better condition.
Excellent. That's incredible to hear these stories. I know we've had a few people also join the webinar in the last moment. So if you have questions, we're doing this in real time. If you have a question, please type it into that question section on the software, and then I can ask that question directly to Dr. Sheela. So this is really more of a panel discussion. So if you hear something and you'd like to hear more, please just type that in there and I can help to moderate. We did have actually one question that's come in already that is asking about training. So all of the examples you've provided were examples where you were present for the patient care. But how do you...
No, there are few, yes. Yeah,
okay.
It's a good question.
But,
so now, yes, I'm the head of the department, but I have trained my colleagues in my department. So these are the incidences I shared where I was present, but there are incidences where I was not present. In my absence also, they have used this garment for the cases of postpartum hemorrhage in labor room. I mean, these patients were not shifted to OT. They could manage them in labor room. The patient was bleeding and they applied this anti-shock garment and they could manage.
Excellent. And what have you found is the most effective way to train your staff? Is it by actually conducting training webinars or training seminars where you're using mannequins, or is it on real patients? What's the most effective way you've found to train your staff?
Yeah, when we train them, we have you can call it as I mean, all the time it's difficult to get a patient, so simulation. So we ask one of the volunteers, okay, to lie down, and then we demonstrate how to apply it. A volunteer lies down, any of the girl student or anybody's there. We apply on them and we demonstrate, and then we make them apply that, okay, to know that how tight it should be, that they have to hear that snap sound once we apply that. So then they feel more comfortable. And then when we take them through all the process, like suppose if the patient is conscious, how do you apply? If the patient is unconscious, how you apply? Then how to remove, which is equally important again, and when to remove. So that is again equally important. So it's not that we train only doctors, we also train the nurses and the midwives in the labor room, because it's very important to train all the staff, whosoever is there. I mean, we call them as skilled birth attendants, or nurses and midwives. So even they are trained and it's kept in the labor room. So whenever it is required, even a staff nurse or a midwife should be able to use it. And now suppose if it is one unit, yes, it is better to train everybody. Now what happens in conferences is we have simulations. So we have large number of people coming up, but we have different stations because the other stations are also there where we teach management of postpartum hemorrhage. And one of the station is, yes, the anti-shock garment. So each group at least spends 25 to 30 minutes on this station where the complete procedure of demonstration is explained.
Excellent. And is this a product that most people or most of your staff understand quite quickly because it's a very simple to use product?
Yes. Yeah. It's very easy to learn. Now, I think one of the states in India, that is Tamil Nadu, where have this NASG government at every level. Like they have one at primary health center, then 4 at comprehensive health center and medical college. Even every ambulance has it. And even they have trained the ambulance drivers also, because sometimes if the patient is getting shifted from periphery, and if the help is not available, so to that extent they have gone and they have found excellent results. Like when I talk to them, and we have Millennium Development Goal, which very few states have achieved in time, and that is one of the states is Tamil Nadu, where the deaths due to postpartum hemorrhage have come down drastically, and they really find it very helpful. Even in periphery, mainly in periphery, they are using it.
Excellent. And I know you mentioned Tamil Nadu. Are there any other regions of India that you've worked with the NASG? I know you're based in Karnataka, but what other regions of the country have you introduced the NASG?
I have introduced it to Rajasthan, okay, and I think Pathfinder people have already introduced it in Northeast area as well as Bihar state, I have introduced it in Karnataka. So
Excellent.
yeah, so in Karnataka, still I will say that it's not enough. Even just 1 month back, I did again one more simulation or a demonstration for them, for the people from government setup of Karnataka. And because they have the garment, but they are not using it. So the main purpose of conducting that program was to again enlighten them about this, that how to use it and where it is useful. So that really helped them, because they have the garment, but they are not using it. Like, I mean, they don't know when to use, whether it will really help, whether and in what situation they should use it.
Interesting. And do you find that's common where people have the garment, but they just need more training for how to use it?
Yes, I think the follow-up is very important, because if they have the garment and if it is just lying down there and if they have not used it. So yes, now as it is with the government setup, the district health officer takes a note of it, that how many facilities are having it and have they used it or not, how many cases of BPH were there, and how many people used it, and they are trying to propagate people to use it more often.
Excellent. And we have a few questions that have come in. The first one is from someone in Nepal asking if you have done any workshops or training in countries outside of India. So they mention Nepal, Bangladesh, Sri Lanka. Have you done any workshops or training in those countries?
I have still not done, but I have an invitation from Bangladesh now, because few of the delegates who attended, I think, the BPH workshop at Rio, so they have requested. So I have a request from Bangladesh, and I think recently I was involved. I was there as a faculty at Rio, where we had a BPH simulation workshop. So I was a part of it, and mainly people were from Latin America, Brazil, Egypt, and yes, Sri Lanka, Bangladesh, Pakistan, because still the number of mortalities, the deaths due to postpartum hemorrhage are still high there, and really found it very useful.
Excellent. And another question that just came in is about when you apply the garment, is there a certain standard number of hours that the patient should or can be in the garment, or is it based on the discretion of the medical provider?
It depends on the patient's condition. First is we have to assess the patient condition. If she has lost blood, we have assessed the blood loss, we have to replace it. So at least for 6 hours, we are going to keep it. After that, we assess her condition. We check her hemoglobin. At least it should be 8 grams and above. That means whatever she has lost, we have replaced. Her pulse should be less than 100 beats per minute. Her systolic blood pressure should be above 100. And she is not bleeding anymore. That means even if she had a loss, we have controlled, we have corrected. The uterus is well contracted, or whether there was a trauma, we have corrected, and the patient is not bleeding anymore, and she is stable. Her vitals are stable, and now we know that she is in a stable condition. In that situation, we can think of removing the garment, and we have to remove it successively. Like suppose if we remove the first segment on both the legs simultaneously, we wait for 15 to 20 minutes and we check all the vital parameters, the pulse, blood pressure. There is no change in pulse and blood pressure. After 15 to 20 minutes, remove segment 2. Patient condition is stable. After 15 to 20 minutes, remove segment 3. So like that, you may take 1 hour, 15 minutes to remove the whole garment. But suppose in between, if you have removed one segment and you find that there is a change in the parameters, then immediately reapply all the garments. Reassess the patient condition, whether she is still bleeding, or she still needs replacement or more oxytocin. So we have to reassess her. Now, when I was discussing with these people from Northeast area, because they are in hilly areas, I asked them their experience, for how long you keep this garment. They said that as we are in hilly area, sometimes it's very difficult to get the blood and blood products in time. And if the patient has lost more, suppose we have given her already 2, 3, she's stable today, but that's not enough. And after some time, we think that she's stable and we try to remove, then we found that no, she's not stable. So we have reapplied that and we we have to wait for some time to get the blood again. So in that case, we have waited and we. So sometimes they have kept the garment for 24 hours, also 48 hours. That is the experience from Northeast. But they could still wait and arrange for the blood and blood products or correct the other situations, and then they were able to remove it. So yes, first thing, it depends on the patient condition. Second things, it depends on the clinician's decision, but the clinician has to be comfortable and sure that the patient is stable and she's not bleeding anymore and her vitals are normal.
And that's perfect. And so there was one follow-up question to that. Just to confirm, can the garment be put on the patient and then taken off and reapplied if for some reason the patient needs to have an adjustment made? I think you mentioned you can start from number 1, obviously, but you can reapply numbers 4, 5, 6. What would be the process for removing and reapplying should there need to be that adjustment made?
See, once we have applied the garment, removal, we have to be very, very careful. Suppose if you find that one of the segment is loose, okay, we can just apply it tightly, okay. Now the need to change or replace the garment is if the garment is really soiled, okay, because that can again cause hypothermia. In that case, as you said that there are so many videos available, you can have a look at the video. We are not supposed to remove the garment totally and then apply the other one. We have to again go on successively. So we again put this new garment or the another garment under the patient. Remove segment 1, we apply segment 1. Then we remove segment 2, we apply segment 2. So like that, you will have to do a replacement segment wise, because there is no question of removing the garment once it is applied suddenly. Because what will happen is, if you remove it suddenly, the blood will again come to the peripheral extremities and again there will be a fall in blood pressure. So one has to be very careful when you are shifting the patient to any other place. Either a person accompanies the patient or the people, those who are going to receive her, are trained and they know how to remove it and when to remove it. So the communication, the training is not that it has to be only in one place, but surrounding centers, surrounding facilities also should have the awareness about the uses of this garment.
Excellent. That's perfect. And there's only one more question listed on here. So again, if anybody on the webinar would like to ask a question, now is the time. You can type that into the question section and I can ask on your behalf. But the last question we have is just about, now I know the garment can be used over 140 times, but in your experience, the question is about how often or how long do you use one garment before you think you should replace it? Is it 1 year, 2 years, or is it just based on number of uses?
It again depends on how it is maintained by the staff, So sometimes what happens, if it is maintained properly and it is washed and dried up and neatly folded and kept, then there is no problem. But sometimes what happens, when we are folding and keeping it, we have to be very careful that we are not using the Velcro when we are packing it. Because if the Velcro is left in place for some time, when we are trying to remove that, there is some damage to the garment. That's my personal experience. So there is a way to fold it so that the Velcro is applied in an opposite way, so that the way we applied on the patient, not but the opposite way, and then it's properly dried up and kept folded and kept separately. So we have seen it that it's used multiple times, but once it is the elasticity is gone, then sometimes it's very difficult. Yes, the theory, we know that it says that you can use it 100 and 140 times, but it again depends on the maintenance of the garment by the facility.
Of course. And so that's all the questions we have. Is there anything that we didn't discuss today that you would like to share with our attendees to just share your knowledge?
The few people have shared their experience, and we also have used it. It is also useful in ectopic pregnancy. Okay, because the patient, most of the time they are in shock, and even in Jodhpur in India, Rajasthan, when I had done a workshop, after that they have started using it, they shared with me their experience. They found it very useful even for ectopic pregnancy patients who come in hemorrhagic shock, and they found it very useful.
Excellent. That's good to know. We often are asked about using this product outside of pregnancy and other traumas, which that's not obviously the intended use, but it is a use that some of our medical providers have explored for other traumas. So that's fascinating to hear. And I thank you for your time. I know it was late in the day for you, and there was quite a few questions. Oh, actually, we have one more snuck in. Okay, so the last question actually is one that I won't have you answer. We have a few questions that have come in about making orders, about cost, about shipping, things like that. Those are questions that
I think that you can.
Yep, exactly. So if you go to, again, the VIA Global Health website, we have our product page for the LifeWrap non-pneumatic anti-shock garment. All the information is there. If you have interest in making a purchase, you can just click that request a quote, fill in your details, and we'll come back to you with a quotation, any shipping information, any details about the product itself when it comes to an order. We can handle that directly. So if you have questions or you'd like to watch the videos or learn more about this product, you are encouraged to check here first on the website. If not, we're happy to answer your questions and you can send in a request. But that's just to touch on that quickly. Thank you very much, Dr. Mane, and it's a pleasure to have you. And for everyone else on the line, thank you for your attendance, and we look forward to you on the next VIA Live product training webinar. Thank you very much.
Thank you. Thank you, everybody, for being there. Thank you.
Bye.
Thank you, Brian.